Welcome to the practical session about enamel histology. In this session, we will discuss the histology of enamel in more details, and we will see more slides to explain what we took in the theoretical lecture. We will focus on all the histological features we explained in the lecture. So we will see how would enamel look in a ground and in a demineralized section, the basic structural unit of enamel, which is the rods, and we will talk about some features or some phenomena that are seen in the enamel, like gnarled enamel, Hunter-Schrager bands, and about the phenomena that we can see on the Argentino enamel junction, like the spindles, the tufts, the lamella. Then we will talk about the incremental lines that are seen in the enamel, which we called the cross striations and the stria of Ritzius. Also, we will talk about some phenomena that we can see on the surface of the enamel, like the perikymata, the caps, the focal holes, the brocs, and the ameloblast ends. Finally, we will see some histological slides that talks about the Dentino enamel junction and the Cemento enamel junction. As we discussed earlier, enamel is highly inorganic. It has 96% inorganic material, which means it's best studied in ground sections. As in ground sections, the organic substance is burned and the inorganic substance remains. The enamel remains, the soft tissue or the pulp is burned. While, as we can see here in the decalcified section, the enamel is lost. It's demineralized. The basic structural unit of the enamel is the enamel rod, as we said. The enamel rods take different patterns. Among them, the most prominent one is the keyhole pattern. As we can see here, every head has a tail, and every tail is between two another heads. In the core of the head, the crystals, the hydroxyapatite crystals, walk horizontally to the long axis, while in the peripheries, the crystals deviate. In the tail too, the crystals deviate. This deviation in the tail area and in the peripheries of the head is the cause of sharpening the boundaries of the pattern and make it more visible to eye. Hexagonal enamel crystals each contain many hydroxyapatite molecules organized in a lattice pattern. We already mentioned that the enamel hard material, our inorganic material, is hydroxyapatite crystals that are hexagonal in shape. How do we see the rods is dependent on the angle that we cut the enamel with. So in the section, if we cut the enamel rods in a vertical direction, 90 degrees, we will see an optimal keyhole shape. The more we proceed towards zero cutting angle, the shape will become more and more circular to be finally amorphous. There are mainly 4 different patterns that can be seen when we cut enamel rods: the keyhole pattern, a head and a tail, the circular pattern, the stacked arches. As you can see, they are arches that are simply stacked over each other, and the irregular one, which are more seen near the Dentino enamel junction. Again and again, the crystals run in a horizontal path in the core and deviates in the peripheries and in the tail, which gives us the boundaries, the clear boundaries we will see in the next slide. As we can see here, this clear boundaries, more pink boundaries, caused by this deviation in the crystals angles at the peripheries and in the tail. The keyhole pattern, but this is not an optimal one, which means we are between cutting angle between 45 and like 80 or 70. A circular pattern, mostly what we can see here is the keyhole pattern. And when the enamel rods are cut in longitudinal section or longitudinal direction, we can see it like this. So those are cut in longitudinal section and longitudinal direction, and these are cut in cross section. In higher magnification under the electron microscope, we can see the core of the rod sheath, which is covering the head or covering the core, the tail, and the head. Going higher and higher in magnification, we have the interrod material, which, as we said, has higher organic material percentage. Also, under high magnification and electron microscope, we can see how the crystal direction is much different between the body and the tail, and how also is the crystal direction is different between the rod sheath and the rod core. That's why we have different banding or color, because of the change in direction of the crystals. We also mentioned in the lecture that enamel rods take a wavy or undulating course because the ameloblasts take this path while secreting the enamel. It's more obvious when we track the rods. So when the enamel is in an area like cusps where the surface area is smaller, the enamel rods are more stacked because of the smaller surface area or the smaller area. So they wingle around each other in what we see as gnarled enamel, where the rods twist over each other. As we also see here, they make this twisting phenomena above cusps mostly. Gnarled enamel. Also in the lecture, we explained that each 10 to 13 layers of rods take different direction than the rods above it and below it, which gives us or shows an optical phenomena called Hunter-Schrager lines. They can be cut, this group of prisms, either longitudinally, as we can see here, or in cross section, as we can see here. The ones that are dark, they are called the parazones. They are cut in longitudinal cut or direction. The light ones are the diazones, and they are cut in the transverse direction. Don't forget that Hunter-Schrager band is an optical phenomenon, which means we can only see it when we expose the tooth into light. You can see the bands in all these sections. These bands strengthen the enamel structure. Now we will discuss the tufts, the spindles, the lamella, which are all phenomena that we see on the dentino enamel junction. The spindles, as we said, are the extension of the dentinal tubules into the enamel, about 25 micrometer of the enamel length. They are tubular structures that are so small, 8 micrometer in diameter, and you can see they are not homogeneous with the enamel structure. They look like the dentine structure. We can see them most commonly behind under the cusps, where the area is smaller, so the odontoplastic processes are pushed a little bit out of the dentino enamel junction. As we can see here, they are continuous with the dentine, the odontoplastic processes in the dentine. Again and again, they look like the processes in the dentine in color and shape. That's how we can know them or differentiate them from other structures. Along with that, they are smaller and they have different shape. We will see in a few seconds. Again and again, in a cusp area, you can see that these spindles are an extension from the dentine into the enamel. They don't go along the prisms. And what we see here is gnarled enamel. The enamel is twisting, the rods are twisting on each other, making gnarled enamel. The other structure is the tufts. Tufts mean something looks like grass. So as we discussed in the theoretical lecture, tufts are hypomineralized areas that are found on the dentino enamel junction. They have different lengths, but they are not so long. And as you can see, they are homogeneous with the rod structures around them. They have the same shape and direction. As you can see, they have nothing to do in the size and form with the odontoplastic processes beneath in the dentine. Here we can see the difference between the spindles and the tufts. The tufts are hypomineralized areas that are longer and has a different shape. They are longer and wider, and they are homogeneous with the structure of enamel with the rods, while the enamel spindle is very small in length and in width, and they are not homogeneous with the structure of the enamel. Lamella is the third phenomenon we can see on dentino enamel junction, which are hypomineralized areas that extends from the dentino enamel junction almost to the surface of enamel. They are structural faults in enamel. In this slide, as we can see, these are most probably tufts. the enamel, the dentine, the Argentino enamel junction. This small tuft-like structure is tufts, and this one is lamella because it reaches the surface of the enamel. Spindles can't be seen in such magnification. They are so small to be seen in this magnification. Lamella can be seen the whole length of enamel. So we have two kinds of striations, incremental lines in enamel, the cross striations and the stria of Ritzius. The dark lines that cross the enamel rods at a 90 degrees angle, they are the cross striation. And we said before that they represent almost daily rhythm of enamel formation or mineralization. They can be seen only on very high magnifications. Again, cross striations passing the enamel rods in 90 degrees. Again and again, but this is a low magnification picture, so it's harder to see these lines. They are so near to each other. And again, under higher magnification, as we can see, they are further apart from each other. Also, we discussed in the lecture how the cross striations distance between each two cross striations is different according to the location of the section. This stria of Ritzius are the incremental lines that represents almost weekly rhythm of enamel formation. They cross the enamel rods in an oblique direction. Each two stria of Ritzius have 7 to 10 cross striations in between them. In a cross section, you can see the stria of Ritzius as circumferential lines like the tree lines, the lines we see in the tree when we cut it in cross section. Of course, this is the enamel, this is the dentine, this is the dentine enamel junction. This is lamella, and these are tufts. In a longitudinal section, this would be the Argentino enamel junction. What is here? The dentine, the enamel, and the stria of Ritzius can be seen as lines in the enamel. Again and again, a cross section in a tooth where we can see the enamel, the dentine enamel junction with the scalloped shape, which means we are in an area of high shearing forces like under a cusp, and the dentine. You can see the stria, the enamel stria or the stria of Ritzius as lines that run circumferentially. Another section which is obviously under cusp. See how the lines of the stria of Ritzius are visible also on this section. Most probably this would be a neonatal line which tell us the difference between the enamel that is formed before birth and after birth. A neonatal line is kind of enamel stria because it also represents a difference in the maturation and components of the enamel, but it's a more marked one. It's much more visible than the other lines. Also, as we can see here, this is the enamel, this is the dentine, and this is the dentino enamel junction. Above the cusp here, we can see the enamel twisting on each other, what we call the gnarled enamel, and this is a very well marked enamel stria, which we call the neonatal line. So we have finished talking about the phenomena that are seen inside the enamel. Now we will talk about the surface of the enamel. The enamel stria are shown or visible on the surface of enamel as these circumferential running lines that are called perikymata. So the ones that are high we call the perikymata ridges, and in between them there is the perikymata grooves. These are seen when the tooth is freshly erupted. They go away after a while with attrition and abrasion. Also, these small dots that are seen in the perikymata grooves and ridges are seen under the electron microscope. They are the prism end markings where the ameloblasts that secreted the enamel were actually sitting before they are vanished. On the surface of enamel also we can see what is called the caps, the enamel caps, which represents formation of enamel above some debris. When those debris or this enamel above the debris are lost, we end up with what is called the focal holes on the surface of enamel. Also, another phenomena that can be seen on the surface of enamel is enamel brocks or brocks, which are an extension of some enamel crystals above the surface of enamel. Now we will discuss the Argentino enamel junction and the cemento enamel junction. As you remember from the lecture, the Argentino enamel junction has this scalloped shape in the areas of high shearing forces or impact forces like under the cusps, while they are a little bit smoother in lateral surfaces. The Argentino enamel junction is less mineralized than the enamel and the dentine. Another view that shows us the Argentino enamel junction scalloped shape. The cemento enamel junction. As we mentioned in the lecture, we have 3 different patterns of cemento enamel junction. The first one where the enamel and the cementum meets end to end, or where the cementum overlaps the enamel, which is the most seen pattern, or where the enamel and cementum fails to overlap, whereas a gap of dentine is found. This is related to a lot of clinical issues or pathologies that can happen in a tooth. Among them, I mentioned sensitivity of teeth, because the dentine is a very sensitive tissue, and when it's exposed, like in this case, it can cause sensitivity to the patient. The last pattern that I don't have a picture for here is when enamel actually overlaps cementum, and this happens when only 1.6% of the time. That would be everything for today. Next lecture we will be talking about dentine. So next lecture I wish you all the luck. Bye bye.